Thanks, Chelsea. Hello, and thank you for joining our presentation today. I will review ransomware in your practice. Don't let nightmares become a reality. I will review what is ransomware and how does it work, why healthcare data is under attack, what to do if you've been hit with ransomware, some cybersecurity best practices and resources available to you. I hope that the information I provide to you today is helpful. Please feel free to type any questions or feedback into the chat. We'll be hosting additional cybersecurity-related webinars monthly, and we hope to see you again on our next one. If there are topics that you would like for us to cover, feel free to throw that into the chat as well. Let's get to it. I'm sure everyone on this webinar is familiar with the word ransomware. If you drive a car, you probably heard about the Colonial Pipeline attack in May 2021 that made us all scramble for gas. If you're a baker, then you may have noticed that there was a cream cheese shortage last winter, which made holiday baking challenging. That shortage wasn't completely due to supply chain issues. One of our largest producers in the U.S. was hit with ransomware in October 2021. I'm sure you've seen it on the news or heard from a colleague. Ransomware is scary and it can affect anyone. Basically, a hacker gains access to data, encrypts and exfiltrates a copy of your data, and then they demand ransom. The objective is to stop your processes so you are forced to pay a ransom. Common ways that ransomware attacks can happen are through phishing emails and social engineering. Unpatched systems and software. The Cybersecurity and Infrastructure Security Agency, called CISA, releases a list of vulnerabilities identified in software almost daily. Around 50 a week are identified and published so developers can create patches to resolve those vulnerabilities. If you aren't updating your computers and software, then you probably have a vulnerability in there somewhere. Out-of-date antivirus, anti-malware, firewalls are other ways a hacker can get into your system. Even downloading a program from a website. Let's say you need a PDF printer and you find a free version online. Well, it could be sketchy to download anything that's free. If it's cheap and fast, it's usually not good. Additional avenues used to gain access to your data could be misconfigurations, like human error, and unsecured remote access programs. So RDP, VPN, how your remote or hybrid or even vendors get access into your network. Let's review the anatomy of an attack. Let's say the bait was a phishing email. Your HR person received a faux email from an employee to update their direct deposit information. They click the link and the infection begins. The employee could immediately be locked out of their computer, or the malicious software begins to download and starts to save your data over a period of time and you simply have no idea. At some point, the ransom notice pops up. Your files have been encrypted. Now you have to decide, do you pay the ransom? Is it even legal to pay the ransom? How can you restore your data from a backup and continue seeing patients today? Just a note, the FBI does not encourage paying a ransom because it doesn't guarantee that you will get access to your data, and it provides funds for criminals to commit additional crimes. Let's review a few scenarios to think about what you would do in these instances. First one, your computer gets compromised. Can you isolate that computer from your network? How about if your network gets compromised? You should be able to drop to paper to treat patients as with any emergency policy and procedure. But how would you make medical decisions during this time? I'm sure you know a lot about your patients, but can you send a prescription? Are you familiar with every single piece of information to even make those decisions without your data? How long will it take to have your computers wiped clean and restored from a backup? The statistics on healthcare practices and ransomware are alarming. Cyber attacks on healthcare are up by 71%, which skyrocketed during the pandemic due to our reliance on technology. 43% of cyber attacks are aimed at small businesses, usually because they have outdated equipment or software and are typically easier targets. Recovering from a ransomware attack cost businesses $1.85 million on average in 2021. The cost of a ransomware attack isn't just in ransom. It's also in sending your employees home and not seeing patients until you get up and running again. It's the cost of new equipment to use while your old equipment is down. It could be the cost of time it takes for a patient to be seen elsewhere and coordinate that referral. In the Colonial Pipeline attack, they were down for 6 days, and some systems didn't come back online for a month. We'll go to it more in a few slides, but consider looking into cybersecurity insurance and how that can help your practice recover from a security breach. Healthcare data is more valuable than your social security number or credit card data. Think about it. Your healthcare data contains not only the basic personally identifiable information, but your protected health information, which includes your pharmacy, dates and times of your doctor visits, your insurance information, and all of your medical history. Criminals publish the stolen data on the dark web and make a ton of money, which is why they target small to medium-sized practices. They're hoping to find a way in and get a paycheck. If they can get into your system, and let's just say you have 1,000 patients' data, I'd assume a lot more, but at 1,000 patients, the hacker made $250,000 in a day's worth of work. Healthcare organizations that are impacted by a security breach are required to report it to the FBI and the Office of Civil Rights. If your breach has over 500 patients compromised, then your company will be listed in their online breach reporting tool, which is commonly called the Wall of Shame. A practice will stay on the list for 2 years. This could impact your insurance premiums or reputation. Healthcare covered entities are required to complete a security risk assessment each year to be compliant with HIPAA. One of the questions within that assessment is, do you have an incident response plan? Everyone on this call today should already have an incident response plan in place, and if you don't, you'll want to make sure that you create one. Here are a few high-level items that should be included in your incident response plan. Isolate infected devices to prevent further inspection. Locate the source of the infection. Follow your escalation process by reporting the breach to authorities and your cybersecurity insurance carrier. And restore data through backups and check for decryption options. If you don't have cybersecurity services with DAS Health, please know that we have an entire security team here, and we certainly can try to help give you some guidance or clarification on what is happening to you or your systems. So now that we've discussed all of the scary things about ransomware, let's review how to prevent it. This is our list of cybersecurity best practices. Enable multi-factor authentication. MFA is probably one of the cheapest safeguards to implement with the most protection. Unless a hacker gained access to your account and your cell phone, they would never receive that second code to complete the authentication. It is the biggest bang for your buck. You should have it implemented on your email, public access like RDP or VPN, and any software that contains patient information. Employee education and training. Along with annual HIPAA training, you should educate your employees on security awareness. A common practice is also to perform simulated phishing campaigns to test your employees' knowledge of detecting a faux email. Your employees are the first and last line of defense. If the link wasn't clicked, then access could not have been granted, at least through a phishing attempt. If it sounds or looks strange, don't click it. Ask someone directly about it. Something important to know is if your practice has fallen for a phishing email in the past, then a hacker will most likely continue to send phishing emails to see if they can trick you again. They can also post your information on the dark web for other hackers as they've discovered that your practice may not know any better and fall for future attempts. Back up your data and often. Once the breach occurs, you have two options. Pay the ransom and cross your fingers, or wipe your devices and restore your data from the last backup. If your last backup was a year ago, there's a lot of missing data to piece together. Keep devices and software up to date. Previously, I mentioned how CISA publishes vulnerabilities for the public. This is why you need to ensure that all computers have the latest and greatest updates. Sometimes the settings on the device will allow the user to suppress the updates, so you may want to make sure that you periodically force those updates to your users' computers after hours or on the weekends. Endpoint protection automatically detects and prioritizes potential threats to quickly see where to focus attention and know which machines may be impacted. 24/7 monitoring. A security operations center is a resource that you can leverage to collect logs from your devices and software. It actively searches those for malicious activity and will filter the noise to focus only on real threats. A SOC will also receive those reported vulnerabilities from reputable sources and scan your network and report if any of your devices or software contain those vulnerabilities. It is a top recommendation for best practices to protect you from cybersecurity threats. Vulnerability management is a question included in your security risk assessment, cybersecurity insurance application, or if you accept credit card payments. Vulnerability management exposes unauthorized logins or attempts to restricted computers, identifies a new user profile suddenly added to business owner's computer, or if a new user was just granted administrative rights and more. So it's going to detect any changes that happen in your network. Cybersecurity insurance is something that we really recommend you investigate. Cybersecurity insurance is its own policy, and the application process has gotten tricky lately. We receive applications all the time from our clients, and there are new safeguards listed in them every few months. In general, if you adopt these technologies, it will improve your position with your broker. Tabletop exercises are a common practice and recommended by CISA to perform regularly. This is where you sit around a table and run through your processes from breach identified to data is restored. If you are on vacation, do your employees know how to respond to a breach, or will they wait to notify you when you return? The longer someone has access to your network, the more damage that can be done. Continuously mature your cybersecurity posture. It might be challenging to implement every recommended safeguard at once. It is the recommendation to have all the necessary safeguards in place. However, a strategy that works well is to continue to mature your cybersecurity posture. Conduct a technical security audit to gain a baseline, understand all of your risks, and make a plan to mitigate those risks. While we're talking about best practices, password security is something so simple that can really be a helpful safeguard. This password complexity chart was very interesting to me the first time I saw it, and I wanted to share it with you. I know that having a longer and more complex password is becoming a thing with most websites. In the past, we would create a password using 6 characters, and it turned into 8. Now it's 12, and we add in the number and special character too. In this chart, we can see why creating such a complex password is beneficial. Layer MFA on having a complex password, and you should feel pretty good about your password security. I hope most of you on this call today already have a cybersecurity insurance policy to help protect you. We've been seeing additional questions regarding MFA, encryption, SOC services pop up on the applications. I put together a few screenshots from a recent renewal application and wanted to share it with you so you can plan and prepare for your insurance renewal. The cybersecurity insurance landscape is evolving as there have been more breaches and claims filed. Insurance carriers are requiring businesses to implement more safeguards to protect themselves, which will reduce the amount of claims filed and therefore payouts they have to make. If you notice something new on your application and want to better understand that safeguard, and if it makes sense for your IT infrastructure, please let us know. We have seen and heard it all, so we certainly can help you make heads or tails of it. I put together resources that I use to stay informed and up to date. You can subscribe to alerts directly from CISA at CISA.gov for new vulnerabilities identified. And you can follow active cybersecurity legislation on Congress.gov. Currently, there is a Healthcare Cybersecurity Act that directs CISA and DHHS to collaborate on how to improve cybersecurity measures across hospitals and healthcare networks. We think any safeguards that will be required at the hospital level will eventually trickle down to the practice level, so it's worth keeping an eye on this legislation. There is also the Protecting and Transforming Cyber Healthcare Act, better known as the PATCH Act, which is requiring manufacturers of medical devices to design, develop, and maintain patches throughout the life cycle of their devices. Also something interesting to pay attention to. There are Senate hearings that you can watch online, which are interesting to see what's really happening out in the critical infrastructure industry, which includes healthcare. I found the Colonial Pipeline Senate hearing personally very interesting. The CEO spoke to decisions they made as the attack happened and lessons learned. There was a recent Health, Education, Labor, and Pensions, called HELP, Committee Senate meeting that reviewed how the federal government can and should address the pandemic of cybersecurity threats. They also discussed tabletop exercises and best practices. If you have a Google account, you can set up Google alerts on keywords, which will pull articles published or news into your inbox, which can be really helpful as well. And DAS Health is absolutely a resource available to you. We have an entire cybersecurity team here at DAS Health, and we are dedicated to fight the good fight for our clients. Our team holds various degrees and certifications in the industry, and we report to our Cybersecurity Vice President, Mike Spur. We will continue to host webinars and support you where we can. Our biggest fear is that a client didn't know their cybersecurity risks, and we know that preventing a breach is significantly cheaper than recovering from one. We are currently offering cybersecurity posture reviews to our clients. This is not a technical security audit, but rather an information sharing conversation about cybersecurity threats and vulnerabilities that may exist for you. Each practice's IT infrastructure can be a little different, so we would like to connect with you and investigate some areas that are worth calling out and addressing to ensure you have a good cybersecurity posture to defend yourself against a threat. We are here as a partner and want to give you information that we have and are experts on so that you can simply be aware and make a plan. We also have a cybersecurity checklist that we will be sending out with the slides and a recording of today's presentation. We hope that it's helpful to you and that you're able to save it and compare it to your current operations. You may have guessed, we do offer several cybersecurity solutions at DAS Health and can help you address real risk areas that you may have in your cybersecurity posture. Security audits and assessments are recommended to be conducted on an annual basis. At DAS Health, we run automated tools that search for vulnerabilities, conduct a penetration test to see if an outsider can get into your network, and we have created our own expert manual review that looks at over 60 additional function areas within your network. We provide you with a risk-ranked list of vulnerabilities and help you come up with a mitigation plan. Sometimes the results uncover crazy things like holes in websites, and even small things like inactive users over 30 days that should just be disabled. Some really good things have come out of conducting these for clients, and if you don't know the last time you had a technical security audit, it's probably time to schedule it. We offer a solution to complete your annual security risk assessment. Our tool also comes with annual HIPAA training for employees, HIPAA policy and procedure templates such as the incident response plan that I mentioned earlier, places to upload copies of your vendor BAAs, and track security incidents and access. Security awareness training is education that you can provide to your employees so that when they are presented with a faux email, they can detect it immediately. How well do you think your employees can detect a scam? Our solution offers annual security training and then throughout the year, little micro refresher trainings, simulated phishing emails, and security policy and procedure templates. MFA for RDP or VPN access is something we also offer here at DAS. If you have remote staff or hybrid workers, please make sure that you've added MFA to layer your security and prevent the ability from a hacker to get into your network. During one of our posture review calls, we reviewed VPN access with a client who was concerned that a vendor they had used had notified them of a breach. Come to find out, one of the users who had access to their network was from that vendor. We immediately locked them out and required them to change their password. SOC services is a solution that we offer here at DAS Health. Think about all of the logs of data that come from all of your various devices and programs. It would take a little bit of time to filter through all of that data to identify a real risk. Our SOC services team is a 24/7 operation based in the U.S. that contains several veteran cybersecurity experts, and they filter through all of those logs and flag real risks. The quicker you stop the bleeding, the less the damage. We receive alerts for employees traveling outside of the U.S. Most of them are legitimate, but we did run into one where a CFO's account was accessed in another country, and it was not legit. We isolated the login and called the client immediately. With our vulnerability management products, you can develop ongoing capability to detect risks introduced into your environment by new or zero-day vulnerabilities, configuration errors, system changes, hacker footholds, and tools. Endpoint protection alerts and stops ransomware attacks, privilege escalation, malware outbreaks, and various other threats by centrally managing endpoints. I know I've said it a few times, but I'll say it again. We're here to help you protect your business. If you have any security questions or concerns, you can send them to security@dashealth.com. If you'd like to schedule a cybersecurity posture review, there's no cost to it. You can email me directly at heather.benefil@dashealth.com, and I'll be happy to coordinate that call with your account manager. Thank you for sticking with me, and I hope the information has been helpful to you. Feel free to throw some questions or feedback into the chat so we can continue to be a helpful resource.
Great, thank you so much, Heather. And again, thank you everybody for joining us today. And let me just take a moment to explain that personally, for me, this topic is huge because, a little embarrassing secret that I hate to share, but it seems really pertinent to share given the topic of this information. In one of my previous jobs, I actually brought down our entire network through ransomware. I clicked on something that looked absolutely legitimate. It looked like an invoice from a vendor that I was expecting, and I encrypted the entire network. We had to roll back our whole systems for 2 days because it wasn't caught for 2 days. So if you think of how much gets done across your entire organization for 2 days, that can be a lot of lost work. So shockingly, I'm still here to tell the story and laugh about it now. It was a number of years ago. Otherwise, I wasn't laughing about it quite so much at the time. But this is such a real threat. And I mean, it was a fairly small company at the time that you would never have expected was going to get targeted. But like Heather said, they're really targeting some of these small companies now because they know that, there's no other, there probably isn't the infrastructure in place to prevent it. So I would encourage you to take advantage of Heather's resources and ask questions and get the information that you need and educate your employees because this is such a very real threat with very serious consequences. Okay, so with that, now that I shared my cringe story, please, I'd encourage anybody who has questions to type them in the control panel. We have a couple of minutes here to answer them. We're going to go through them in the order that we received them. We only have a couple, so if you have questions, now is your chance. Don't hesitate to ask. There clearly are no silly questions since I just shared that mortifying story. Okay, so Heather, the first question we received, can we use personal email for business? Sometimes it's easier when we're on our phones.
So it is recommended to use company email for business purposes. You'll also want to enable the multi-factor authentication. And if you have Office 365, there are additional features that you can enable as well, such as Defender, which will then turn on scanning that checks for it'll check your emails for safe links, safe attachments, and help filter out phishing emails. So you really have a lot of security if you move to a company email, and that would definitely be the recommendation.
Great, thanks for that, Heather. I know that frequently it is a lot easier just to reach for cell phones, but there are ways around it. There are things that we can do. We can still make this easy. So those are the questions you should be asking. You should be thinking is how can we do this better? Next question. I think you mentioned this, but I can't remember now. When are the security risk analysis due? Sorry, security risk assessments due?
Yeah, it's a great question. So you will want to complete one each year, and it should be dated for the year that you're in. So I would make a goal to have yours completed at least by December 31st this year. I probably wouldn't wait till then. You do want to retain them on file for up to 7 years. And any mitigation items that come up out of completing your security risk assessment, you'll want to review those and address them before your next year's assessment.
Great, thank you. And it looks like this may be our last question, but again, if you have questions, just spit them out. That's what we're here for. So this question says, if my work computer was infected with ransomware and I sent a document to my personal computer, will my personal computer be infected too now?
That is a great question. What we would probably want to do is isolate that computer and have somebody from the security team investigate it, just to see if that virus could have spread. So that's something that I would send into the security at DAS Health. Obviously, just to notify them that you think your work computer has been infected, so we can help give you some guidance through that process.
Okay, great. Well, thank you so much, Heather. And again, if you think of any questions after the fact, we'll be sending out slides and the recording. You could reply back to any of the webinar emails that we've sent out. And again, you see Heather's information up on the screen as well as our security desk. So basically, any way you can get a hold of us, we're happy to help. Don't hesitate to ask. That's what we're here for. And thank you very much for joining us. And we look forward to seeing you hopefully at our future webinars. We got some really great ones coming up in the books here. So thank you so much and have a great day, everyone.